we're like cats in the library. We actually don't know what's happening. We just go to our doctor and we think we're so smart because we understand so many things. And we've read up and we've been on the internet before we go to the doctor, right? And we think we know, but all of the information really has this overlay on it, which is the profit motive.
Ed Morgan, my friend, how did you come to write a book called The Patient's Survival Guide, 7 Key Questions for Navigating the Medical Maze?
Well, if we think of our lives, Eric, like a tapestry, we have all these threads running through our life. And one of the threads running through my life, which had nothing to do with the homeless and the poor, has been the medical thread. Ever since I spent a year in bed when I was 7, and
did your parents find out about that?
Yeah.
No, seriously, a year in bed when you were 7 years old.
That's a lot of truancy, right? No.
How did what happened?
Well, I took one of the early sulfa drugs, early antibiotics, and the early ones had a tendency to crystallize in your kidneys. And so you come up with nephritis.
So not all drugs are safe? Who knew? Because I'm getting boosted and vaccinated. Just kidding, folks. I got to be honest with you, Ed. As the years pass, I become more and more astonished at the problems with the medical system and how many of us look at doctors as gods and think whatever they say, and more evidence comes out. You're telling me that 7 decades ago, you're prescribed an antibiotic that
it's well known.
Puts you in bed for 1 year. That's not what they're supposed to do, folks. So that's amazing. I never heard this about you.
But God used it for good. Because, I was reading at grade level when I first took to my couch, and when I finished the year later, I was reading at 10th grade level.
Oh, you're kidding. Yeah, but you're a genius. That's cheating.
No.
So
that's what helped me all my life.
But in all seriousness, you're prescribed a drug, an antibiotic, and basically the side effect sounds like practically kills you, puts you in bed for 1 year.
Yeah. Well, antibiotics, are one of the classes of drugs that have genuinely helped mankind.
No doubt.
There's no question. It's their overuse. I mean, there's many classes of drugs today that are not helping mankind. And, sulfa drugs, fine. That's
right.
been for 30, 40 years.
Okay.
So also, another reason the medical thread has run through my life, I got into it with my wife, Judy, who came up with first breast cancer, stage 1 breast cancer, and boy, did I get into it. And really, I found that poor science is part of our cancer treatment industry today.
Poor science, bad science. I think you want to be clear.
Sloppy science.
Sloppy science, which actually is not science. So because you're a bright guy and you rolled up your sleeves and got into it, you began to see what was wrong, and this book is your answer to that, to try to help people navigate what you call the medical maze.
Yeah, it's worse than a medical maze today. I kind of went off center for the title of the book, but Don Berwick, the head of public policy, medical public policy at Harvard, says today, basically the pursuit of wealth now dominates healthcare.
Okay, let's think about this, because I've noticed this
and
thread.
Its implications, yes.
This has happened. This is evil, ladies and gentlemen. Journalism, the medical world, these used to be professions where it was sacred. Getting the truth in journalism was sacred. It wasn't about profit. In the medical industry, it was about the Hippocratic Oath. It was a sacred calling to heal the sick. The profit motive crept in, and of course, because you and I are both Christians, we understand that apart from virtue, everything goes to hell. And when you suddenly have a medical industry that has been leaning more and more toward the profit motive, that is scary stuff.
Totally. Well, wonderful guy who wrote my foreword in the book, Dr. Norton Hadler, Yale, by the way, Harvard Medical School, distinguished faculty member at UNC, Chapel Hill. His quote is just beautiful. In the U.S. today, healthcare is a commodity, disease is a product line, and physicians are a sales force in the employ of a predatory enterprise. How's that for a quote?
Well, but I mean, that is really, really dark stuff. That is really scary stuff when you think that
Yes.
most people, where else do you go? And we're not talking about socialized medicine, folks. That's got its own problems. We're
right.
talking about we're talking about medicine in general.
Runaway capitalism.
I want to read. This is Norton Hadler who wrote the foreword. I want to read his endorsement for your book. He says, it's common sense to assume that improvements in population health are a direct consequence of the advances of diagnosis and treatment for which the healthcare system is quick to take credit. But a great many of the putative advances have withstood scientific scrutiny poorly, if at all. There's been a choir singing that truth for some time. Ed Morgan is contributing his voice to that choir. He brings a keen perspective tempered by a life course devoted to caring about those in need. The Patient's Survival Guide, that's this book, is a clarion call. Perhaps this is the voice that will fill the pews. Almost everyone listening to the sound of my voice right now is dealing with this in one way or the other.
Yes.
So you have seen this, Ed, and you're a methodical, thoughtful person. And so
Yeah.
as you've gone
I've
through this with your
watched-
wife, Judy, and with your dad, and I mean, through your life, you've seen this, and this book is the result.
I've watched so many friends die actually unnecessarily or ahead of their time. You read the church bulletins, please pray for Sally. She's having her carotid artery operated on tomorrow. Oh, wow. So much new industries in the pursuit of wealth. You want to hear a couple examples?
Yeah.
Like, what wasn't a big industry 20 years ago? AFib, atrial fibrillation.
Talk about that.
Yeah. Well, in the last 10 years, through new drugs that have come out, and a wonderful statistic, if you have atrial fibrillation, you're 5 times as likely to have a stroke. Of course, that is true in one sense, but if you look at the actual absolutes, the absolute risk, it's very low. 60% of people over 60 have AFib, have episodes of atrial fibrillation.
Okay, so what the medical industrial
So-
complex says there's money to be made. What do?
What do? Well, ablation, the interventional cardiologists go make a lot of money off of it. And
So
of
you're
course,
saying
the
this
blood
is
thinners,
often unnecessary surgery.
Yes, and unnecessary drugs. Now we're talking about the new class of blood thinners. Once you start taking those, you're not a well person anymore.
And what is this class called?
Well, it's blood thinners. It's Eliquis, Xarelto, Pradaxa. These are billion-dollar drugs.
And you're saying, generally speaking, they do less harm than good. We're going to go to a break. We'll be right back. Folks, I hope we've piqued your interest. Don't go away. The book is The Patient's Survival Guide, 7 Key Questions for Navigating the Medical Maze by my friend Ed Morgan. You were just talking, Ed, in your classically Pacific way. I just get angry instantly when I hear about
Yes.
this stuff. But you're a calm, rational person. And you're saying that the medical industry is more motivated by the profit motive than it used to be, which is a scary thing, and that they are doing operations and prescribing drugs that ultimately are not to people's benefit.
Exactly. 50% of Americans over 50 take more than 3 drugs and are diagnosed with a chronic condition. This was not true 50 years ago, right? This is not true in Europe. In Europe, there's not $5 billion worth of advertising per year for prescription drugs, as we have here, called DTC, right? We're the only civilized country, other than New Zealand, that actually allows advertising for prescription drugs. And the runaway American big pharma system is just gone crazy in terms of profitability. And
So do these people have no souls, no consciences? I mean, it's an extraordinary thing that when you're entrusted with people's health to turn a blind eye to some of the things you're saying. It's chilling to me. And again, we speak as men of faith. It's a chilling
Yes.
thing to me when people genuinely lose sight of the real bottom line, which is to say
Yes.
what is right and what is wrong.
So what does a former executive like me do about something like that? I have 30 books on my shelf from Norton Hadler, my friend, and others that say, we're going to reform this. We're going to make this work. My goal here is just to save a few, is to have people exercise wisdom when they confront the medical system. Proverbs talks about 3 kinds of people, all in the book of Proverbs in the Bible, all 3 kinds of people, the wise, the fool, and the simple. The fool's made up his mind. He's going to go the wrong way. The wise is able to confront life. And the simple, many of us are wise in spiritual things, but we're not wise in medical things. We're simple. We are the major market for all these drugs and procedures that constitute overtreatment, overdiagnosis, overtreatment, and galloping medical mistakes. Because hospital treatment today is so complex. One of my heroes down at Johns Hopkins, Marty McCary, estimates that 250,000 people die unnecessarily in hospitals every year through medical mistakes.
I mean, that's astonishing. Marty McCary, he's a friend. He's been on this program. He is a brilliant MD. So when he says something like that, that's chilling.
Yeah, right. It's hard to fathom, right? So that's a lot. And, other people estimate up to 400,000, the population of Cleveland every year die out of the hospital, and in the hospital unnecessarily because of the big 3, which is overdiagnosis, overtreatment, and medical mistakes.
Well, let's talk about overdiagnosis. I mean, mistakes are mistakes, and
Sure.
But I'm not excusing them. But I'm saying overdiagnosis, overtreatment. There are people like my mom and dad on a vast array of drugs. I can't keep track. I'm sure Aliquis, which you mentioned, is one of them. Yeah. What's the story? What do you do?
Yeah. Well, you were asking what is an example of overdiagnosis,
Yeah.
for instance? Yeah.
Yeah.
Well, okay. How's your thyroid feeling today, right? Thyroidectomies have doubled in the last 10 years in this country because most people have nodules on their thyroid. And in 0.7% of cases, they might turn cancerous. Well, no. What happens, of course, is that
That's kind of like you could have brain cancer. We better cut that head off, proactively. Let's be proactive and
Yes.
prophylactically cut off your head because you could get brain cancer. So you're saying that there's money to be made and that there are people incentivized to say, let's get rid of the thyroid. And what's the patient going to say? Oh, I guess I better do it because what do I know?
Yes. And the thyroid is much more complex than they'll tell you, and there's internet support groups for the tens of thousands of people that have lost their thyroid unnecessarily that would never have had any trouble from it. The definition of overdiagnosis is basically being diagnosed with something that will never cause any trouble in your life,
Okay, so you mentioned all these drugs that people are taking. You mentioned Aliquis is one that I've just heard my parents mention, but blood thinners, all this kind of stuff.
Yeah.
What, generally speaking, what would you say about that?
Well, there's a whole class of drugs. I'd say blood thinners are one that have just moved up the scale hugely, or growing at 25% compounded every year. Another class of drugs is the immunosuppressants. You'll see them on TV every night, but they never called them immunosuppressants.
What do they call them?
Well, Humira is one of them. They call them. They'll help your skin disorders. They'll help any autoimmune disease.
At what cost?
Well, by suppressing your immune system.
Okay, that's a little scary.
Yeah, suppressing pieces of your immune system. So later on, drugs are tested short term, and then they're licensed by the FDA.
Okay.
So long-term testing is very short in this country. Very scarce. So if you really try to look into how you're not really told what the long-term consequences will be if you're prescribed Humira, for instance, or could be, So I actually followed the train through down to specialized types of lymphoma that are hard to treat, and all other kinds. Well, you want to talk about statins, right?
Yeah.
There's another class. 43 million Americans on statins. Or is it 47?
And what is that for, statins? What is that?
Statins lower your cholesterol.
Right.
They're thought to be harmless.
Yeah.
So, but long term, well, they're the common muscle weakness is one thing that they don't mind saying, but type 2 diabetes. Did you know, for instance, 50% of your brain by volume is cholesterol? No, okay.
No.
So what you're doing when you take statins, 43 million of us do, is you're lowering the production of bad cholesterol in your body, but you're also lowering your brain's ability to replace cholesterol.
So, in other words, a doctor's not incentivized to say, eat better.
Right.
He's incentivized to say, keep doing what you're doing, and here, take these.
Well, that's a very good point.
That's
right.
pretty scandalous, because he's not making money if you cut out fatty foods and bad food. He's not making money off of that. So he is making money if he says, statins, here you go.
Yeah, and I would say the great majority of PCPs, primary care providers today, are very compassionate, caring people, but they're no longer free to be clinically wise. They're employees,
That's what's scary.
Yes. Well, that's
They're
right.
employees, that there is, what is it? Some hospital is mandating that
Yes.
they push X, Y, and Z.
Standard of care, right. They have
Yeah.
production goals
Yeah.
and standards of care. So the statistics are astounding. The big medical hospitals and insurance companies are snapping up doctors and making them employees to an amazing degree. 22% only of American doctors, only 22% are left practicing alone or in a small group.
So
The
do
rest,
we have
78%.
anybody going to war against this, Ed? I mean, your book is a different subject, but I'm saying, is there anybody out there trying to change this institutionally? Because this sounds like a nightmare.
I have 30 books on my shelf that have been tilting at this windmill for 20 years.
Yeah. It's
No traction.
hard. It's hard. Well,
No
it's like
traction.
a industrial complex. Okay, so in the book, actually we're out of time in this segment. We'll be right back. Folks, the book is The Patient's Survival Guide, 7 Key Questions for Navigating the Medical Maze. Ed is a trusted friend, and I'm very glad he's written this book. We'll be right back. People just get sucked into this, and most of us have been taught to kind of trust our doctors.
Yes.
So what about that?
Yes. Well, as we were saying before, there's 3 kinds of people in the book of Proverbs, and the simple are those who, in Proverbs 22, for instance, who just go on their way. The wise turn away from danger, and the prudent, but the simple go on and get clobbered. It says in the Message, version, and a lot of us are wise about a lot of things, but we're like cats in the library. We actually don't know what's happening. We just go to our doctor and we think we're so smart because we understand so many things. And we've read up and we've been on the internet before we go to the doctor, right? And we think we know, but all of the information really has this overlay on it, which is the profit motive.
Okay, and it's hard for us to sniff that out, but you're saying that the doctors themselves are part of a system that they have very little power over.
Yes.
So what do we do about this?
Yes. Well, with your PCP, with your primary care provider, you can try to, you can in fact make a agreement, an arrangement with them. I should read how I actually put it in the book. But sit down and say, you know, I've read a lot of things about my condition or et cetera. Would you be willing to try conservative treatment here for me? I don't want all the latest tests. I don't want the latest drugs. I would just like to have your best clinical judgment, not necessarily your practice's standard of care. And so those are two different things today.
Not necessarily your practice's standard of care. In other words, you, the doctor, are under this pressure to go with a quote-unquote standard of care, and you're saying that patients need to say,
which is,
can we go outside that system? Can you give me your...
would you feel free just to give me your best clinical advice? Not what you would do for your mother, but what you would do for yourself. And do we really need to go to a CAT scan on this yet, right? Or et cetera.
Now, what would be, playing devil's advocate, what would be the problem with going to a CAT scan? In other words, first of all, there's money that is expensive, but the insurance covers it. We're part of this grand corrupt system. But for the patient, what harm is done to the patient in getting that CAT scan? I'm not clear on that.
Yes. Well, besides the money and the exposure, cumulative, it's estimated, 2 to 4% of cancers, are the result of all the exposure we have, X-ray exposure today. But that's not as big a problem as another whole episode in medicine called incidentalomas. A CAT scan will pick up, for instance, I had a friend who had a new heart valve. They CAT scanned him to see how things were going. The heart valve is just fine, thank you, but it reached down to his kidney.
You mean the CAT scan?
The CAT scan did.
Not
right.
the heart valve, just to be clear. So the CAT scan reached down to his kidney and they saw what?
They saw what 15% of us, imagine how many millions that is, saw was a shadow. And now the question is, what do you do about that? What is the clinical... you're sitting in front of your doctor, and he says, your heart valve is fine, but you have this shadow on your kidney because we reached down there. What do you think we should... You ask him, well, what do you think we should do about it? Okay, so here comes standard of care versus clinical judgment.
Right.
If you're not wise or if you're simple about this, you're going to believe everything that he says, when actually 0.7% of these incidentalomas, particularly on your kidney, turn out to be aggressive or in any way dangerous to your health. So the question is, should you go for a biopsy, which is very, very difficult, or
so you said 0.7. So in other words, less than 1 in 100. So we're talking about like 1 in 130 cases.
Correct.
Is this going to be a problem? So pretty much not a problem. But they say, well, we want to be careful. Let's have a biopsy, which is a major thing when the odds are near zero that this is a problem.
Yes, right. And this is a problem all over in mammographies and the whole thing.
And there's money to be made on the biopsy and on everything down the line. There's
right.
a whole system.
So this friend ended up, once the cancer word was mentioned, having his kidney out and
having
have-
his kidney out.
Right.
It
No,
was
this
not,
happens
It was not
thousands-
cancerous.
Well, as it turns out, the pathologist said, well, there's a collection of abnormal cells here,
Which could eventually become cancer.
which could eventually become. You have to be sorry for a pathologist, however, because they have the hardest job in the world, right? They're not going to want to call something benign if it's right. That will
So
end
they're
their-
saying, let's play it safe and we'll all make a lot of money. Hey, what
Well,
a deal.
It's not coached in those terms.
Well, but isn't this the
Couched
bottom
in
line?
those-
Like, look, first of all, let's play it safe. It's not costing me a penny. I don't have to get my liver out. I don't have to get my kidney out. So let's just go with it. That's where we are. We'll be right back. We're talking to Ed Morgan. The book is The Patient's Survival Guide, 7 Key Questions for Navigating the Medical Maze. Just a minute left. Reiterate, if you would, what you think, other than buying the book, which I recommend, The Patient's Survival Guide, what people ought to do.
People ought to forge a new pact with their doctor and say, can we talk for real?
And some doctors won't do that, though. Isn't that the case?
That's right.
Wouldn't you
So
think? So
maybe-
how do you find a doctor that will be real with you?
Yes, you have to find one of the 22% left, or you have one of the concierge doctors, or one of the 22% left, mostly in rural areas, of doctors that actually want to talk to you with their own clinical judgment and are not scared of their employers. And it's a really...
That are not scared of their employers. So not part of some big system would be
right.
ideal.
Yes, that would be ideal. I think in the future, we need to establish a coterie of doctors
Yeah.
that actually
That are willing to
believes
give it to me straight, Doc, really straight.
Yeah.
The book is The Patient's Survival Guide, 7 Key Questions for Navigating the Medical Maze, by Ed Morgan. Ed Morgan, thank you for writing this book, and thank you for your time. Really appreciate it.